My name is Norton Hadler. I'm a rheumatologist on the faculty at the University of North Carolina. For today's Healthy Life Moment, I want to discuss the breakthroughs we've been hearing that relate to the surgical treatment of low back pain. We hear about breakthroughs of all sorts almost every day, of new treatments and new drugs and new diagnoses. This is a different breakthrough. After 50 years of surgical inventiveness, we finally tested whether or not surgery for low back pain works. Now we're learning what we need not do. Now, low back pain is a very common experience. Most of us will have at least one episode every year, and whenever we have our low back pain, we have learned to be concerned that we may have some disc or spur or other damage that's going on to give us a bad back. And we usually cast about for people who could help us, knowing full well that if all else fails, there's always a surgical remedy. Fortunately, groups of surgeons in our country and abroad have been testing the effectiveness of the surgical remedy for low back pain. If you are a working-aged adult and you are otherwise well and you have low back pain, regardless of the intensity, regardless of the duration, there is no yield in a surgical remedy. You will get as well, as quickly without the surgery as you will with the surgery, and you can avoid the complications. Surgery for low back pain in an otherwise well individual takes its place in the archives next to tonsillectomy for tonsillitis. This is Norton Hadler with today's Healthy Life Moment.